Hello, everybody. It's Tim Richter here, president of the Canadian Alliance to End Homelessness. Welcome to our webinar. First of all, just want to let you know that everybody is going to be muted. We've got about 1,000 people joining us for this webinar. So everybody will be muted. We'll go through the program and some housekeeping items shortly. But I know that this is a huge number of folks that are in our frontline organizations, frontline services, doing the heavy lifting of responding to COVID-19 for people experiencing homelessness. And I just wanted to take a minute to say thank you, to know that your service and your work is appreciated. And as horrifying as COVID-19 is, it may be, it's also, for me, certainly heartening to see the movement of people, the army of people, of Canadians, and there are folks, I think, on this from across the country who are responding to, across the country and around the world, frankly, who are responding to homelessness. So I just want to say thank you very much, and I appreciate all your work. So welcome to this webinar on COVID-19 and responding to unsheltered homeless folks. Our agenda is pretty straightforward. I'm going to do a brief introduction. We'll have a presentation from Iain DeJong, who we'll introduce in a second, and then a question and answer period. So just to let you know, a couple of housekeeping things, because we've got so many people on the call, please use the question and answer tab to ask questions. You'll see the tab in the control panel just says Q&A. You can press that and ask a question. There'll be too many people on the call for me to try and keep up with the questions through the chat. But please use the chat function to share. Sometimes what I'm seeing in the COVID response across the country is that there are some great ideas, there's some great examples, there's some good responses happening around the country, and so there may be an answer to a question you have, or there may be a resource that you're looking for available on among your peers. So feel free to speak up and use the chat function to talk with one another or the panelists. The other thing is a recording of this webinar will be, oops, I goofed on the typing here, but on the CNH3 website, cnh3.ca/resources, a recording of the webinar will be available there, as well as a copy of Iain's presentation. And you're also going to find a pile of COVID-19 resources there. So we've been collecting information and resources from all over the world, some great examples and really useful stuff that you can put to work in your shelter or organization. Please feel free to go to that site, find all the information that you need. It's constantly updated, so please feel free to keep checking back. So I'm now pleased to introduce Iain. Iain DeJong is you can read his bio here, but he is well known across North America as a leader in ending homelessness and one of the leading experts on a range of different things, especially shelter transformation, housing first, things like responding to people who are outside and who are among the unsheltered homeless. I will now turn it over to Iain. I will just stop sharing and let him share his screen. It's over to you, Iain, and I'll let you turn on your camera and I will get out of the way.
All right, so just confirming that you can hear me and you can see the screen. Is that correct?
I can see the screen. Yeah.
Excellent. So good day, everybody from across Canada and parts of the United States who are joining us today. Thanks for the introduction, Tim. I am grateful to the Canadian Alliance for establishing this opportunity to talk about the COVID-19 response for unsheltered homeless persons. Our topic today examines COVID-19 response for unsheltered persons, and I want to welcome you to participate in the discussion as you feel necessary by using the Q&A that Tim spoke before. Questions out. We're going to do our best to respond to as many or like questions at the end. Please note, however, that given the volume of people who are on the webinar today, it may not be possible to get to every single question. We will try to address whatever we can, and I have ensured that there's going to be time left at the end to cover and deal with some questions. At OrgCode, we continue to figure out how to fine-tune our offering and support during the time of COVID-19. If there are other ideas or materials or the like that you want to have covered, by all means, you can reach out and email us, info@orgcode.com. I'd also encourage you to reach out to the Canadian Alliance to End Homelessness with your ideas. They are great at finding a range of experts who can speak on a variety of topics. And if you are interested in what OrgCode is doing during this time, stay tuned to the OrgCode Facebook page and Twitter feed. And just really briefly about me, a lot of my attention the past couple of years has been spent transforming the space of street outreach to put a finer point on the need for professional service providers and a strong focus on housing with a coordinated access interface. And once upon a time, I used to run a very large street outreach program. If you need to know anything else about me, know this: I'm a very strong advocate for ending homelessness, and I want to make sure that even in the midst of a pandemic, we're not losing sight of helping people access housing. So just a few more words before we get started. I want to be really clear that we're still learning when it comes to responses to unsheltered homelessness and COVID-19. It is entirely possible we'll learn more and even change course of direction as we acquire more knowledge. So consider today's webinar to be the best possible information that we could synthesize and pull together from reputable resources within the time allowed, knowing that it is entirely possible that some directives that come out from other health authorities may change as we move forward. I also just want to say, by way of preamble, I am offering absolutely zero direct health advice today, but I am going to provide some guidance and considerations regarding what street outreach workers can do to try to keep themselves safe and to try and promote the safety of others. But I'm not going to get into the weeds or pretend that I know everything that there is to know about COVID-19. So what you'll hear today are promising and emerging practices and some thoughts from some of organizations that I'd say are leaders in street outreach. So the first thing that we need to tackle is, why does street outreach need to continue at this time? Because if you are in a position where you reach a different conclusion, if you are in a position where you say street outreach does not need to continue for the time being, then I'm going to ask you to, where would you redeploy your street outreach resources currently? It may not make sense to be having street outreach staff trying to work from home and not engage with others, especially when there are shelters and other emerging responses within communities that do require human resources. So I'm going to lay out some reasons why I think outreach should continue, and I'm going to invite you to deliberate if these reasons also make sense for you and are relevant for your organization. So first up, I think street outreach should continue because people who are homeless are likely to be terribly and disproportionately impacted by COVID-19. The figures on this slide are American. Undoubtedly, I think we're going to see similar disproportions in Canada, though perhaps not quite as severe, given we have fewer cases and given the nature of our healthcare system. We need to do outreach, I think, because this is a population that is likely going to get sick. When they do get sick, it will come with grave consequences if we don't stay connected and have mechanisms for helping them access health resources if needed. As imperfect as the VI SPDAT may be, it does provide a wealth of self-reported data. And we've learned lots about the differences between sheltered and unsheltered persons through the analysis that was conducted by the California Policy Lab at UCLA. We know, for example, that the acuity of unsheltered people on average is about twice that of sheltered homeless persons. We know lengths of homelessness are a lot longer amongst unsheltered persons, especially amongst those who identify their gender as female. We know that 47% of unsheltered men and 63% of unsheltered women report struggles to take care of their basic needs, and that was before COVID-19. We also know that unsheltered population has many more contacts with police and emergency medics. And finally, we also know that when considered as separate variables and altogether, that unsheltered persons have greater likelihood to report physical health issues, mental health issues, and substance use issues. In fact, just shy of 50% of unsheltered persons can be classified as trimorbid according to self-reported responses to the VI-SPID Act. So I would say we need to do outreach because we're talking about a fundamentally different and more vulnerable population on average than their sheltered homeless counterparts. Day services, in addition to outreach services, are main points of contact with helping professionals. In many communities, we are seeing reduced hours or closure of drop-in centers and hygiene facilities and food programs. Typically, we could use those as another avenue for trying to connect with unsheltered persons and provide ongoing information and support. And obviously, that's happening less or not at all right now. So I would argue that we need to do outreach because unsheltered persons need a point of contact with the Homeless Services delivery system. In some instances, we may also need outreach to help with food security and navigating access to bathrooms and showers and laundry where possible. You and I both know that information is updated very frequently regarding COVID-19. Some of this information is entirely relevant to people who are unsheltered. Things like which resources are open, what do I need to do to protect my health, has somebody else who is homeless caught the virus? These and other questions or variations thereof are increasingly common amongst unsheltered persons. Sometimes the flow of information that needs to go out pertains to new initiatives specifically concerning unsheltered homeless persons. For example, in some communities, hotels and motels are being made available to unsheltered persons. In some instances, these are just for people who are infected with the virus and need to be isolated. In other communities, this is for all unsheltered persons. I would argue we need outreach to provide a steady and reliable flow of information to people who are unsheltered. It is in the best interest of every community to do early detection of all people, homeless or not, to see if they're exhibiting symptoms of COVID-19. You and I probably know these by heart now. People disconnected from a 24-hour news service cycle may not. It is also possible that some unsheltered persons lack the cognitive capacity to know or think about symptom recognition and what to do if the symptoms are found. We need to do outreach in order to do non-clinical symptom screening and navigation for people who are unsheltered and have symptoms to get them to the most appropriate resources. We have heard anecdotal reports from a number of communities that they are seeing some people that had stayed in shelters moving outside because those people who had been staying in shelters have a belief that being outside will be safer than being inside a shelter with so many other people at this time. This may or may not be accurate, and at this point, we don't know the scale. We do need to assume, however, that this is a possibility. We also need to accept the possibility that there will be an increase in homelessness as a result of the economic fallout from COVID-19, and we may have more people to serve, including through outreach when this is done. So I would argue that we need outreach to do engagement, redirection, and problem solving with people that have left shelter, and we need outreach to do early capture of people entering into homelessness. Housing remains the only known cure to homelessness. Want to assist people in self-isolation, whether that is this wave of coronavirus or the next? House people. Want to help improve their health outcomes? House people. Turns out that housing is good health care. And if you want to have less homelessness should another pandemic ever rear its ugly head, house people. Coordinated access should not stop at this time. In fact, outreach efforts may lead us to unsheltered persons who previously were unknown or would not engage, who now want housing and need to be on the by name list. Furthermore, if there are vacancies at this time, we should still work on filling them as expediently as possible through coordinated access, and outreach has a clear role to play in the process. It may not seem like it, with everything going on, feeling urgent and important right now. But we are going to need to wrap our heads around the fact that we need outreach to keep people progressing towards and achieving housing to get out of homelessness. Every service provider outreach benefits right now from having a predefined workflow. The workflow should capture everything from screening to assisting with self-isolation. I was able to get a hold of this workflow prepared by Alberta Health Services that is specifically for individuals with no fixed address, though it doesn't delineate by sheltered or unsheltered. I still think it's quite comprehensive and simple to understand. Rather than going through every step of this in detail at this point, I'll ask you to refer to this in the slides that are being provided to attendees of the webinar after the conclusion of the webinar. But let me just say this now. If you have not created a workflow for the entire homelessness system and the interface with health services in the context of COVID-19, create one. And you, if you are an outreach practitioner, probably need to start thinking through the steps that an outreach worker would take from initial engagement right through to isolation. Now that I've shared what I think are the core arguments for why street outreach should continue, I want to turn our attention towards precautions that should be taken when responding to unsheltered homelessness through street outreach. I'm not really sure what I can add to this one that public health officials have not already been yelling from the rooftops. Wash your hands a lot. If you can't, use the right type of alcohol-based hand sanitizer. Making it a habit to do this at the start and end of every outreach encounter, unless you have physical contact with a person or the property at this time, which is not recommended, in which case you would do it more frequently. And this one has probably been rammed down your throat already in the era of physical distancing, also known as social distancing. As we approach an encampment we have never outreached to before, and you're not even within 6 feet, I think it would be good to say something like outreach, Iain from OrgCode, anyone there, I want to speak to you about homeless services and COVID-19, and I'm going to stay 6 feet away when we talk for your safety and mine because of the pandemic. You, of course, would modify the script when approaching an encampment you expect to encounter someone that you already know. So that might be like, hey, Phil, it's Iain from OrgCode. Hey, just wanted to point out that I'm going to stand back here while we talk. It's a new protocol because of COVID-19. It's called physical distancing. You probably heard of it. We need to stay at least 6 feet apart to make sure you're safe and I'm safe while we have this outreach encounter. We also need strategies for if and when an unsheltered person approaches you and comes within the 6 foot distance. You know, obviously, I would start with a friendly, hey, can you hold on there a second? And I want to explain why. And then, of course, go about explaining physical distancing. But I'm not naive. If anyone has done outreach to know there's always that one person trying to hug you or give you props or wants to shake hands every time you see them, or gets drunk to the point where they want to dance with you. Anyway, all those past approaches that you had to responding to a situation like this, like shrugging it off or letting people touch you and then requesting that they don't do it again in the future, or just backing up a foot or two but staying kind of close while you keep moving, none of that is in the mix anymore. This is a time to totally disengage and leave if people cannot or will not respect the 6 foot distance separation that needs to be maintained. We also need strategies for engaging with people who are not at their encampment. In addition to the business card or sorry we missed you letter that you may normally provide, you want to consider leaving a one-pager that explains that you'll be coming back and that when you do, you'll be maintaining a 6 foot distance for precautionary reasons during COVID-19. There will be other groups of people where solutions might need to be generated within your community. In particular, one example that we've heard about in the last week was an outreach team that was trying to encounter, or I should say, trying to engage with a person who is hearing impaired. Obviously, trying to explain to them without getting within the physical distancing was very difficult. They eventually came up with a brainstorm solution to use poster board with large letters that explained they were keeping their distance. And yes, these people knew the difference between hearing issues and sightedness issues. They just want to make sure the person could read it. Okay. And some communities are also giving consideration to how do they generate materials to help non-English speaking people understand, or if you're in Quebec, non-French speaking people understand that you want to engage them, but you're going to be keeping a safe distance from them while doing so. The source for these screening questions is Atlanta. Given how fast things are changing, it's entirely possible that these have changed since I sourced them. I want to be super clear again, I'm not a health professional, I'm not providing health advice. This is one area where, if at all possible, you want to get the most current guidance from your local health professionals on which screening questions you should be asking and what exactly they want done from a health perspective if there are affirmatives to the questions. I want to also be really clear that even though these questions make reference to transporting people, I would say in almost no instance will outreach providers at this time be transporting people. And if under very rare, exceptional, and absolutely imperative conditions, you do need to transport someone, doing so only when you're equipped to do so safely, including personal protective equipment, as it makes sense for the type of transportation that's being provided. I can think of very few instances where it would be relevant to touch people's belongings. However, it may come up. The best guidance available at this time that I've found is to ensure people are wearing gloves when touching the person's belongings and to ensure that you have hand sanitizer before and after. All that said, unless it's absolutely imperative, it's always going to be best to have people carry their own belongings. And I would say that not just because of COVID-19. For items of service or in the service transaction that require consent, it may be preferable to examine verbal consent at this time in accordance with requirements for consent and privacy in your jurisdiction. If you already have mechanisms in place for receiving verbal consent, great. If you don't, you can look at everything from a tick box that indicates they provided verbal consent, which also records the date and time that the consent was provided, to doing things like a quick recording on your phone that captures the verbal consent and then attaching that sound file into your database. If you are continuing with having documents physically signed, measures should be taken to improve the safety of the outreach worker and the unsheltered person. There are two challenges that need to be addressed. The first is, how do you maintain physical distancing when there's an exchange of documents? The second is decreasing risk of transmission through the pen, document holders, or documents themselves. On the first matter, as awkward as it may feel, explaining to the person that you need to put the document down, step back, and then retrieve it after they sign it could work. On the second matter, while the information that I found suggests that virus transmission on paper is low, the pen may present challenges because it's a hard surface. Gloves would be ideal in this moment. If not, get a bunch of cheap pens and treat them as single use, where the program participant is going to keep it after signing whatever document is necessary. There are many different definitions of what constitutes an encampment, not just throughout Canada, but also throughout other parts of the world. This is not a webinar trying to define what an encampment is, but I think it's necessary that we have some understanding of what an encampment is for this part of the webinar to make sense. So the very loose definition that I want to use is this: one or more persons occupying a tent or other structure not meant for permanent human habitation in the same or reasonably close location for 2 or more consecutive nights. So what does this exclude? It would exclude people who are sleeping rough without a structure of any kind, and it would exclude people with the structure but move on a daily basis. It seems odd mentioning this to outreach workers and their supervisors who rarely, if ever, want a sweep of a camp to happen. So consider this information more for policymakers, law enforcement, and elected officials. And that you, in some jurisdictions, probably need to be sharing this information with them right now. The Centers for Disease Control has been quite clear that moving people along at this time presents greater risks for the entire community. We do not and should have sweeps of encampments of any kind going on during COVID-19. We need an up-to-date map of the service area of your street outreach team, which marks where every single person is known to be outside and who is in each of the encampments. Full stop. If you haven't prepared this, this can be one of the first tasks that you can undertake to demonstrate the effectiveness and usefulness of street outreach during this period of time. This doesn't have to be fancy. This can be old school paper or taking out a physical map of your city. But you may find that updating and continuous surveillance is easier if you use something like Google Maps. The information you mapped will be critical to planning, prioritizing, and responding for outreach and health purposes. The intention of creating these maps is not to share it for the purposes of sweeping or future sweeping. It is to make sure that we can actually trace and understand people's locations and their contact with the broader community and each other. Physical separation between tents is easier said than done, depending upon the configuration of the existing encampment, if there are multiple people in tents, how long the encampment has been in place, and the geographic area that the encampment is located within. Providing something akin to a floor plan or site plan that lays out how they can reconfigure their camp may be helpful. So you may find yourself with a piece of paper and pencil at the encampment, maintaining at least 6 foot distance from other people in the encampment, drawing out a reconfigured map of how they could better maintain physical distancing and still stay in their encampment. CDC guidance on this element suggests that if there are 10 or more occupants of an encampment, then providing hand washing stations and portable toilets is recommended. This is if there are not public restrooms available that are open and stocked with soap within a reasonable distance. Like many components of the COVID-19 response and homelessness, I think one of the greatest challenges is going to be retracting these type of services once this phase of the response is over. It may also be a challenge to have the portable toilets and hand washing stations properly serviced on a regular basis during the pandemic. Nonetheless, just to repeat, the guidance from the CDC says, if there are 10 or more occupants of an encampment, then providing hand washing stations and portable toilets is recommended if there are not public restrooms available that are open and stocked with soap within a reasonable distance. If your experience is like mine, you have been to some camps that are meticulously maintained, while others are like living in a pawn shop or living near or in a landfill. Basically, as best as I can tell, the thinking is this: the more clutter there is with hard surfaces, and the more those objects may be touched, the greater the likelihood of transmission. So there are communities that have started to figure out how to get garbage service and garbage cleanups to encampment sites, especially larger encampment sites, for the sole purpose of giving the people living within the encampments an opportunity to rid themselves of excess trash and debris around their campsite. We're also seeing a number of novel responses associated to ensuring injection substance users have opportunities to clean up and safely dispose of their needles. While the provision of sharps containers to encampments where people are injection substance users is probably the most ideal response, with a process for following up to collect the sharps container when it is full, there are outreach workers that have looked at alternatives and put in place alternatives like large pop bottles that people can put in their used needles. Community engagement and sharing is the hallmark of some encampments with multiple people living there, while fierce individualism is what's found in others. I'm focusing attention more on encampments where there's a high degree of sharing between occupants. For the time being, I advise people against rampant sharing of stuff. As the expression goes, if everything is a priority, then nothing is a priority. Now is the time to carefully consider the importance and urgency of seeing people you already know and to figure out what proportion of time will be used to find new people. Frankly, not every unsheltered person is going to be important or urgent to see based upon their health and safety and the limitations of your resources. So who then is your priority? Who do we keep hearing is at highest risk for dying from COVID-19? Older adults, especially those with pre-existing conditions like being immunocompromised. Analyze your street outreach data. Analyze it in two ways. Very simple. Who are the people who are older and on your caseload? Who are the people that, based upon your triage or assessment, you figure are less likely to be in optimum health? And from those two lists, you should have the priority of the people that you want to see. If that list is too long, then you may want to consider people who meet both those criteria. That said, I still think that there's a greater advantage in trying to meet the needs of engaging and doing the symptom screening with both those who are older and those who are known to have pre-existing health conditions. You need to be more methodical in your planning than ever. Each encounter, given all the information exchanged and precautions to be taken, is likely to last longer. That means you will see fewer people per shift. Breaking your service area into smaller outreach areas per day rather than running all over the city or a rural county is going to be in your best interest. Use your encampment map to look at things like density and locations of encampments and streamline your engagement from that information. This is going to be a challenge for outreach teams. In ideal circumstances, you may have more time to engage with people who are refusing services and have the opportunity to try different engagement strategies. This doesn't fly out the window at this time, but considerations of how much time you devote to this will be impacted. If you're trying to engage people who were previously disengaged, I think there are two types of people. Those who refuse services prior to the pandemic and those who have refused services since the pandemic. I would recommend using the pandemic as a reason to try to re-engage people that prior to the pandemic declined services. And I would use the pandemic and health screening as a reason for engaging people who have refused services. We will find some people that previously said no to service who say yes now, given circumstances have changed, resources may have changed, and or that some people are scared. Trickier are those who have the information about the pandemic who still decline services. I would still be trying to leave information for these individuals and being clear that you're going to check in on them and their health and circumstances throughout the pandemic. Friendly persistence is going to be necessary for this cohort of people. This is a challenge even when there isn't a pandemic. How much time do you devote to connecting with people who are new when there are already dozens or hundreds of people you know who are engaged who want your services? It's probably best to devote specific time to this endeavor, like 1 day per week or an hour to 90 minutes per shift. What you don't want to do is drive or walk around aimlessly just trying to find people all day. That's like a game of Where's Waldo, and it isn't an effective engagement strategy. I'm hearing about this phenomenon from a number of communities, including some of those that have opened up surge shelter space. While this is not quantified yet to the point where we have good data, in other words, it's anecdotal, I think we need to embrace that this will be the reality for some who think it is in their best interest in order to remain safe by moving outside. The response to this dilemma will vary from person to person and community to community, depending on the state of shelters and their precautions. To carefully read or active shelters with education that they are safe-ish places, if they are. In other instances, it may make sense to start supporting the person through outreach efforts. If you go with this, the latter, you want to use your existing HIFIS or HMIS data to continue services and planning for housing and the like that began when in the shelter rather than starting anew. And we also need to remind other community interest groups that there remains no mechanism to force unsheltered persons into shelter at this time, even if they are symptomatic. If people are symptomatic, then it's up to public health authorities to take action in concert with law enforcement. And this is a dilemma that needs to be brought to the attention of public health officials. They need to provide you guidance on what to do. I've heard of this being the case, but I'm not aware of a consistent approach on how to deal with this from jurisdiction to jurisdiction. What we do know is that it likely does involve some type of law enforcement interaction, and that law enforcement interaction, depending upon your jurisdiction, may or may not be in the best interest of the unsheltered person, even though it might be in the best interest of the community at large. I don't think we have a full inventory of all the posters, pamphlets, and one-pagers that are needed. I think that Tim, for example, in his preamble talked about the fact that they've been pulling together sources at the Canadian Alliance to End Homelessness. I also know the National Alliance to End Homelessness has done something similar. I know that a number of other organizations and groups have tried to be a bit of a clearinghouse or collection point or creating wikis to get the information up and out. I also know that some communities have been able to get this information out quickly, and other communities seem to have holdups with getting everything approved and disseminated to people who really need this information as quickly as possible. But we do need to make sure that we have a range of posters, pamphlets, and one-pagers. So here's a brain dump and a collection of inputs from communities on what to prepare and distribute or post. What is COVID-19? What are the symptoms of COVID-19? What are you supposed to do if you have the symptoms? What are you supposed to do if symptoms are worsening or you are in distress? What additional shelter opportunities are there, or other types of accommodation like motels or hotels? We probably need to get information out to the unsheltered population around things like physical distancing or social distancing measures. And outreach workers might need a different type of "sorry we missed you, but we want to speak with you" document. On top of this, we need some sort of resource list of what's available where and at what time during this time. So you might think of the sort of community guidebook or pamphlet that you pulled together before, which was every meal program and every drop-in center and every street outreach service. And now that probably needs to be adjusted and amended just to what is currently available at this time. We probably also need to provide some harm reduction guidance and some encampment separation guidelines. I don't think there's any perfect way to prepare these, but these are what I think are some really great examples of posters. These also come from Alberta Health Services. Things like how to safely use during COVID-19, what to do if you think you have COVID-19, stop the spread of germs for COVID-19. Very simple, not particularly dense in terms of their text, trying to convey essentially one or just a very few simple messages per poster. Nobody is trying to create the perfect poster that has absolutely every single piece of information in one place. Think of it as separate posters for separate areas of interest related to COVID-19. The Canadian Alliance is putting together what is likely going to be a fantastic webinar on harm reduction considerations. So I want to be really clear, this isn't a webinar on harm reduction, but I think we have a role from a street outreach perspective to be talking about harm reduction, because outreach workers interact with a higher percentage of substance users than the general population, and because health resources that I have seen over the past week indicate that fentanyl and other opioids can slow a person's breathing rate, and as such, COVID-19 may increase the risk of death. So message number one, Captain Obvious for a moment. Reducing risks of harm is much improved if people have housing. Housing is harm reduction. Opportunities to secure financial resources that will help people access alcohol or other drugs if they are addicted or dependent are drying up. Furthermore, we're hearing in some places that unsheltered homeless individuals are having more difficulties finding easy access to their product at this time. Anecdotal, but there are some organizations that also report that people they're doing outreach to that are involved in sex work are finding it more difficult to have regular clientele at this time. And of course, practicing physical distancing in various forms of sex work is an impossibility. And on top of this, there are those who want to modify their use or stop using, and they're going to be facing considerable challenges at this time. We've heard that many inpatient and day patient substance use recovery programs have stopped admitting new people. We applaud jurisdictions like Vancouver, who have developed withdrawal management during a pandemic guidelines. Resources like this are helpful to the broader community as well as street outreach workers to be able to walk people through their service and support options if they're feeling dope sick, can't get access to substance, are irritable as a result of insufficient access to substances, or want to explore pharmacological supports to decrease impacts of reduced or sustained use. We are also hearing that in some jurisdictions, public health resources that previously were available to help with safer consumption sites or needle exchanges have modified hours or have been redeployed to assist with other parts of the COVID-19 response. This is also presenting significant challenges for people who are unsheltered. And what people are using and how they're using it may be changing if they're a substance user at this time and unsheltered. Outreach workers need to provide some additional education if warranted about things like starting with lower doses and working way up, planning their in-talks during COVID-19, like how do you have a buddy system but maintain careful physical distancing. And outreach workers, again, may find themselves in the space of being a public health educator as it relates to safer ways to use at this time. So things like not sharing supplies, including cigarettes, reducing close contact, washing hands or using wipes before preparing, handling, or using your drugs, preparing your drugs yourself. The only printed health information I've been able to find on this comes from British Columbia. They recommend the use of a mask prior to administration. Masks are not required for most outreach work at this time, but this is an instance where having a mask available and readily accessible is in the best interest of the outreach worker who may need to administer naloxone. Consider this. If we are asking people to self-isolate, including unsheltered persons, then the last thing we want are people moving all over town looking for food. On top of this, food security programs in many communities are operating differently, if at all, during this time. In some communities where some unsheltered persons rely upon discarded food, they may also find themselves with less opportunities to source food. So outreach workers may find themselves responding to or bridging the need for access to food for unsheltered persons at this time. One of two strategies probably makes the most sense based upon community characteristics and the nature of how your unsheltered population is organized when it comes to physical locations where people gather and sleep. The danger with using outreach staff in this regard is that food security could quickly become the sole function of the outreach team. I would suggest that communities may want to think of safely mobilizing volunteers to lead, assist, or support this function at this time. Earlier, I briefly showed you a protocol from initial screening through to self-isolation. Workflows like this may need to be amended from an outreach operational perspective to indicate to street outreach workers exactly what they should be doing based upon severity of presenting illness, and including clear instruction on what street outreach staff are supposed to do in the event they encounter a deceased person. An outreach program may already have these sorts of policies and procedures from a pre-COVID-19 era, but these may need to be updated during this time. Captain Obvious, take two. Let's just name it. Now's not the time for first aid heroics. If people are in distress, 911 is called to be making. Unless you have full personal protective gear, and even then, so many cautions would need to be taken in place, and the situation would have to be extraordinary to put oneself at risk at this point in time. And then as sick or deceased people are encountered, two things are going to be important for the self-care of outreach workers and the community as a whole. The first is to debrief what could have been done differently that may, if possible, resulted in a more favorable outcome. And the second, when or if people die, is to remember the dead. Heading into the final stretch here, folks. At the best of times, we struggle to get a segment of the population to see the humanity of homelessness, to acknowledge that we see others within ourselves, to appreciate that every single person who is homeless is someone's parent, sibling, or child. Now imagine that the virus is spreading more rapidly within the homeless population than the housed population in your community. What do you think the response will be then? I don't think we can anticipate every single possible response if this is the case, but we do need to think about it as a possibility. What does that mean for people who are unsheltered? What does that mean for you as an outreach worker? I would recommend preparing some key messaging now for if this does happen. Your best defense in the messaging is going to be related to data and responsiveness. Think of things like how many people have been or are being housed directly from the street. Think of how you frame housing as a solution to homelessness and potentially decreasing the spread of the virus. Last week, I posed this question to leaders in homeless services, and I think it's worth repeating here. What will be our finest minute in this darkest hour? What will be our finest moment for street outreach? For some of you, it will be achieving what was inconceivable before the pandemic began. For others, it will be holding on to some semblance of normal service during these unprecedented times. For others, it will be how you adapt and respond in the face of uncertainty in a shifting landscape. This is not a competition. This is the time to engage in thoughtful reflection of how best to be of use to unsheltered persons during a pandemic, which is uncharted territory at this scale. A collection of resources that you might find helpful as you continue to do street outreach work during COVID-19. Public Health Agency of Canada has put together some great resources. Tim mentioned in his introductory remarks the Canadian Network for the Health and Housing of People Experiencing Homelessness. There's also good work from the National Alliance being done, and OrgCode blogs. If you're not familiar with them, they have some information and thoughts on preparing for and reacting to a pandemic. And then I made mention of CDC guidance. You can find it at that link. And then there's also recorded webinars on infectious disease preparedness for homeless service providers and their partners, and other guidance from our friends at the U.S. Department of Housing and Urban Development. This is my contact information. If we don't get to your question today and it's something that you want to follow up on, I would recommend that you email me, idejong@orgcode.com, or you can text me. That is my direct phone number. Don't call me because I'm not one who answers the phone, but if you want to text me with specific questions, you're welcome to do so. And I also want to assure you that OrgCode is here to help at this time, and we're going to continue to offer as many free and low-cost resources as we can. And so let's move to discussion and address whatever questions we can with the time that we have remaining. Tim, I'll turn it over to you to moderate.
Right on, Iain. Thank you very much. As always, excellent, comprehensive presentation. We've got quite a few questions here lined up for you, so we'll just go through them in the order that I received them and try and group them together. Just a note for people that we're going to be circulating a recording of this webinar, so we'll put together a link, we'll send it around by email to everyone, and if it's okay with Iain, we'll also send along PDF of his presentation. And Iain, if you could, I'd love to get those resources, the sheets that you've linked into your PowerPoint. Lots of people are asking for those. We'll make sure those are all up on the CNHC website as well. So to the questions, and apologies in advance if I start mangling anybody's names, but starting with Bonnie. Bonnie's asking, what are clinicians doing with refusals to be screen tested, isolated beyond the usual things we do in harm reduction, comfort, cigarettes, bribes, etc., to hang on to folks? Any thoughts from, Public Health Act, Mental Health Act? I would imagine that varies from jurisdiction to jurisdiction.
Yeah, it does vary from jurisdiction to jurisdiction as far as we're hearing. We are hearing that, yes, the usual kind of engagement strategies of things like, cigarettes may or may not be effective with people who don't want to engage. I think the fear here is that more communities are going to a heavy-handed law enforcement type approach with getting people to engage. So if we can keep engagement more within the outreach realm rather than the law enforcement realm, and it's not to say that every police officer is doing enforcement. I want to be clear on that part. But those people who are doing enforcement, even if we can make sure that outreach staff are there to try and temper the conversation and get people to focus on solutions. But otherwise, that's kind of a mixed bag from jurisdiction to jurisdiction.
Okay, Debbie is asking, what do you do if your program allows outreach, but your company, I'm assuming organization, will not allow except by phone, text, or email?
Yeah, I think in this situation right now, I would be looking at redeployment. So if your company, your organization, your nonprofit that you're working for says you're an outreach worker, but you can't actually do street outreach right now, then I would be having a really careful conversation around, well, what can I be doing right now? And chances are there's a shelter site or a new motel that's opened up for people who are homeless, where people who have expertise in homelessness would be very much needed right now.
Awesome. One other thing while I'm thinking of it, if anybody on the line, anybody on this call has resources, policies, procedures, charts, samples of anything that would be useful to your peers answering questions or other tips, please send them to me at info@caeh.ca, and we will get those things published. We'll post that in the chat thing in a second. Robert is asking, any ideas about hand hygiene for people experiencing homelessness aside from alcohol-based hand sanitizers?
Soap and water. I mean, obviously that's going to come down to whether or not hand washing stations have been put in place and or whether or not people have access to public restrooms that are actually stocked with soap at this time. But those, I mean, health professionals, especially public health and infectious disease specialists, have been saying over and over again, wash your hands, wash your hands, wash your hands, sanitizer if you can't wash your hands. So let's try to focus on the kind of more obvious solution, which is if I provided you soap and water, maybe that would be easier than trying to get everybody hand sanitizer.
Mm-hmm. Any thoughts on, Jenna Marie is asking, any thoughts on handing out tents and setting up makeshift hand washing stations and encampments? You've mentioned the hand washing statements, but what do you think about handing out tents?
Well, I think I would only be doing this if it was actually a structured sanctioned encampment right now. I'm not a fan of structured sanctioned encampments when stuff like this is not going on. I think it creates too many headaches, but this could actually be a situation where depending on community, I don't want to make this a universal, but community to community, it might make sense to actually set up specific areas for unsheltered persons and the provision of tents within that. Dan McDonald, who's a police officer in Tampa, was just yesterday showing all the work that the Tampa police force has done, setting up rows of tents with physical separation distance as a way of encouraging people who are unsheltered to come to one place that actually does have good physical separation distance, but also has things like toilets and hand washing stations and access to food in one spot.
Excellent. A question that come in via email from Sue. Has anyone developed a safety protocol for frontline street workers in direct contact with folks and sharing food? I think you had some of that answered earlier.
Yeah, I think that the food piece and around the food security. So the danger here is that outreach staff are just going to become couriers of food. And if that's the route that your community needs to go, that's where I was saying it might make sense to recruit volunteers and have them safely do that, so you can do more of the engagement pieces from an outreach perspective. That would probably make the most sense to me. If we do have to do other forms of engagement with people around food, then it's going to be more drop and maintain physical distancing. So bringing food to the site, essentially making a declaration your food is here, and then backing off and making sure that there's still 6 foot separation when the person actually retrieves the food.
Okay. Because of the, Irene is asking, because of the trimorbid conditions that many people have, you've not noted the qualifications of the street outreach service, health professionals or whatever, to address the conditions.
Yeah, I think that that is so varied from community to community right now. I mean, outreach is everything from people with masters in social work to people who were once homeless themselves to people who have never experienced homelessness and have no education. So while a different webinar for a different day would be why it's important to professionalize street outreach services, I think in this instance, it's essentially saying, look, so long as street outreach workers can engage, can maintain physical distance, and can do symptom screening, even if we just had that was prioritized and thoughtful in its response, we'd be further ahead. I don't think we're going to have access to a whole bunch of clinicians at this point in time beyond which we would have under other circumstances. And I especially think if we were thinking a public health professional would come with us at this time, that's going to be a difficult sell in lots of communities.
Tori is asking, what items should we include in a hygiene kit for people who are unsheltered during COVID-19?
So I think we want to make sure, great question, that if you do have hand sanitizer, you want to pass that along, although that's becoming increasingly scarce in most jurisdictions. Access to soap. A lot of people can access water, but they can't always access soap, especially in public restrooms. So making sure that we put that in there. And then the advice relative to masks seems to be shifting at this point in time. And I'm not sure where exactly that's going to land relative to whether or not non-symptomatic people should be wearing masks. But if it does go in a direction where more and more people are encouraged to wear masks, and let's assume that your community has access to masks, it might make sense to include those in a hygiene kit as well, just as providing access to a resource that people might benefit from when they're out in community.
Okay, we talked a bit about sanctioned camps, but here's a question from Jennifer, who's saying that there's been a suggestion in their community to bring folks camping individually, or to find folks that are camping individually and bring them together in a tent city with portable washrooms and hand washing, so outreach workers can support them more easily. They have some encampments that are supported by outreach, but no sanctioned tent cities established. This would be new. Is there any evidence to support this approach?
Well, the key word there is evidence. I don't think that there's evidence. I think that there's ideas. And the ideas tends to be along the lines that you're describing in your question. Would it be a more efficient, effective use of outreach services, and would people be safer if we were able to bring them together to a sanctioned encampment, maintain physical distance, provide access to food, access to water and soap or hand sanitizer? That might make sense in some jurisdictions, but I don't think it's going to be for all. And I think that we also need to qualify that a bit, both for our Canadian and American listeners on the webinar today, to say there are no mechanisms at this point, unless your jurisdiction is special, to force people to go to a sanctioned encampment, even if you created it. So be careful what you wish for. You might create a sanctioned encampment, think that you're going to have a whole bunch of individuals come to one spot and still have, and I'm just guessing here, 30, 50, 70% of your unsheltered homeless population is like, yeah, you might have created a sanctioned encampment, but no, I'm not going. Then what?
Very good point. There's a question here from an anonymous attendee saying, we're getting some community pressure to move individuals who are sheltered in boarding or rooming houses or other potentially precarious housing situations to alternative accommodations during the pandemic. What do you think about that?
So I think safety guides the decision making at this point in time. Mm-hmm. So if you had someone who was in a house situation that made it impossible for them to self-isolate, but you could provide an alternative that would increase the likelihood of self-isolation, that might make sense based upon those particular circumstances. Mm-hmm. But they would be rare. It really would depend upon the design function and flow of traffic in boarding home. The people with the boarding home, group home, etc., rooming house, had a lot of outside contact where they would have the opportunity to bring the virus back in, and would also depend upon what are the alternative accommodations that are available at this time.
Okay. A question here from another anonymous attendees. Any thoughts on how to get a client living in a shelter connected to a hotel? I think that would depend on the city, wouldn't it?
Totally depends on the city. I mean, one of the things that we see in some cities is a move to try to get as many people who are unsheltered and sheltered as possible into hotels or motels if they are symptomatic or test positive. Mm-hmm. And we see other responses that essentially says, it doesn't matter if you've tested or not tested, symptomatic or not symptomatic, we still want to provide access to motels or hotels. So that's kind of really all over the place.
Okay. Andrea is asking a question. She just wanted to get access to the harm reduction webinar that you mentioned is tomorrow. That's been posted, Andrea, in the chat. There's a link there to registration. Look under Debbie Harrison would have posted that. Robert's asking, with many public spaces now closed, any creative ideas on providing space to get some of the needs public space provided or met previously? You mentioned washrooms and hand washing stations, but also charging and or accessing Wi-Fi.
Yeah, so the charging or accessing Wi-Fi, some communities have public Wi-Fi, in which case people are still connected. There has been thought in some places of putting it close to a recreation center or library so that people might get access to Wi-Fi if they're outside. That's probably been the best considerations that I've seen put in place relative to the question of Wi-Fi for people who are going to be in these type of unsheltered situations or even sanctioned encampments at this time.
Okay. We have a question from another anonymous attendee that's asking, we've been getting questions about why we aren't opening a large facility to move unsheltered homeless residents into. Is this a good idea, or should we support people where they're currently at? Our shelter system still has capacity to assist more people.
If your shelter system already has capacity, then don't open up a new facility. In part because that comes down to the if you build it, they will come phenomenon. And I'm not talking about people from outside your city who's going to come. It's like communities that open up winter shelters. A whole bunch of people who would have stayed in your 365 shelters will leave to go to something new. Novel, something that they might see as providing a reprieve from the mundane of their other shelter experience. So I think it's about encouraging people who are unsheltered to use existing shelter spaces or serving unsheltered people within unsheltered environments. But I would not put a lot of time and effort at this time into trying to create a new facility just for unsheltered people. If there's capacity in your shelter system. Now, if your capacity in your shelter system is because your shelter sucks, that would be the only caveat that I put there. And, probably my short answer is you'd already have to have evidence of the fact that the shelter was an underperformer and there was not a space conducive. So we don't just want to go by like a hunch or gut feeling, oh, I don't think they do a good job. Only when the shelters that exist already have some profound deficiencies would I say opening up a new space might make sense.
Okay. Kate's asking, how do you address so businesses that are no longer accepting cash when many unsheltered folks don't have any electronic payment options? Any thoughts on how to address that?
Barter and in kind is happening in some places. I have cash, you don't accept cash. What can I do around your business? I've heard of those sorts of things happening at a small scale anecdotally, but I do think that it's going to be more along the lines of what are they looking to procure, and then how can outreach try to problem solve that procurement issue. So if the issue, let's say, was cash transactions for food, and the business owner is saying, well, we're not accepting cash for food right now, we're only accepting plastic. For the outreach team, it's like, well, then how do we solve the food insecurity issue? Because we can't get credit cards for people who are homeless, or at least not on a scale, even if they were prepaid credit cards.
Well, and I think on another webinar, we talked about isolation and homeless folks that are in isolation, and how do we keep them there, especially if they're actively using. I mean, part of this question is saying how do we keep people from moving too much about in the community, so that they're not, spreading or getting the virus. One of the things, I guess, is, as you say, figuring out what exactly it is they need, why are they going to the business, what are they trying to get, and bring it to wherever they happen to be, and getting creative around, giving them what they need to get them to stay where they are and be safe. Tori is saying, we've seen an increase in unsheltered homelessness in her community, some of whom are not used to being unsheltered. We've discussed potentially opening a campground. Again, we've chatted about that. Could allow for restrooms. How would we address, there are going to be people, I suspect, especially if we have outbreaks in shelters, that are going to go outside to avoid getting sick.
Yeah.
How do you work with people? Any thoughts for working with people who don't have a lot of experience being unsheltered?
Well, I think this would come down to the list of pamphlets, posters, and one-pagers that we might need to pull together for people to help them succeed. I mean, I did mention in the webinar that I do think that, and we are hearing anecdotally in some places, people leaving shelter to go outside because I think it's going to be safer outside than it is in the shelter. And I think that you're absolutely right that there are some people who are not prepared, not accustomed, not well skilled at being unsheltered, especially when there's fewer resources that are available. So we probably do need to provide some access to information on how they can be supported and what resources are available to them at this time.
Okay. Linda is asking, I think this has been asked by a couple of people, just about how some communities are getting shower facilities for unsheltered folks. Have you got any thoughts on that?
Yeah, so communities that already had things like a shower bus or a shower trailer have been thinking strategically around how do they put those in certain locations, and then how do they sanitize them between use. So you're certainly not getting the same volume of traffic that might go through that sort of facility. Other communities where there is like a community center or recreation center that has a shower in it, so like maybe as a facility that also had like a pool in it or a gym in it, some of those have started to think about staggered access with cleaning and disinfecting in between uses. I don't think there's any perfect answer relative to addressing some of those hygiene needs when people are outside, beyond some of which is possible if you already had additional resources like a shower trailer.
Okay. Abby is asking, she's working on convincing parks to leave their bathrooms open 24/7 for people who are unsheltered. They're anticipating pushback from the parks along the lines of, what if people start sleeping in or near the bathroom? How would you suggest countering these arguments other than the basic human need of having somewhere to use the bathroom? The parks have been great in what they've agreed to, in that they've agreed to help their encampment sweeps. Thoughts?
Yeah. Well, I mean, I think we sometimes miss one of the obvious parts, and I'm certainly not suggesting that the person asking the question missed the obvious. It's the park staff. It's like, if we ask people not to do that, guess what? They might not do that. So people have this tendency to go to the worst case scenario. That said, we could, if it's a community that has 24/7 outreach, make a concerted effort in exchange for parks opening up access to the restroom, that we will do rounds, once every 2-3 hours to make sure that people are sleeping within the restroom, if that's what it's going to take to get the restrooms open. But I think signage and information and a request to people that basically says, We need to maintain physical distancing, and we need to provide access to a restroom. As such, please don't sleep in the bathroom.
Brandy is saying that she hasn't been able to find any information or guidance on moving homeless persons into shared accommodation. Any insight into this context? Can we move homeless folks into a shared accommodation while keeping existing tenants safe beyond screening, sanitizing, etc.? Is there anything else we can do?
Kind of stumped me on that one. Let me think about it. I don't have an immediate answer on that one, though.
Okay. Let's see. Sorry. What should we suggest to clients who are homeless and have nowhere to go inside since all community centers are closed? Also, what should we suggest for homeless individuals that don't have a public washroom to use? That's kind of gone over some of this already, I think.
Yeah, I think we've covered the majority of that.
Okay. Here's another question on emergency transportation. So Kristen from Ottawa is saying our street outreach is heavily relied heavily relied on for emergency transportation of the homeless population in Ottawa. How would you suggest managing that or mitigating the risk?
Yeah, so most outreach teams have moved to a we can't transport during this period of time. We do know of some communities that have procured medical transport for extreme cases at this time. And so like non-EMS, but like medical transport, where precautions are being, I think, taken to a high level to try to mitigate transmission during this period of time. So that's probably the best, but I definitely wouldn't be suggesting that it's business as usual for outreach providers who are accustomed to moving people, from downtown to the burbs, or from one location to another, or from the park to the shelter, or anything like that. And, I would hope that if our education efforts are good, we don't have a lot of people who actually are moving around right now. But if we do, I'd be very cautious about outreach providing transportation right now. And it's not because we don't have the mechanisms or the measures to do it more safely. It's just the time that's required between every single interaction to clean, disinfect, try to make sure that the environment is as sanitary as possible for transport, and maintain some sort of physical distancing it's going to be next to impossible to be effective as an outreach worker if you're spending all your time cleaning your van.
Jamie is asking a question. How would you go about getting the city or county on board to financially provide portable toilets and hand washing stations?
Yeah, I think what we're seeing in this one is a lack of understanding of some city and county officials, and to some degree provincial and state officials as well, relative to the importance of access to those resources, especially if we have concentrations of people sleeping outside. The CDC talking about 10 or more people. Even if we could get a start there, and I would point to documents like the CDC document, and I put the link up of the CDC documents you could go and you could reference, that essentially says, like, look, the Centers for Disease Control says that we should be providing access. Don't you think we should be providing access? Like, that might at least start the conversation differently than how it existed before. That's probably the best we can do to get them engaged.
Any tips for, Katrina's asking, any tips for keeping clients engaged over the phone when home visits are not really being done right now?
Yep, so we did an entire webinar on remote housing-based supports yesterday. So if you want to follow up with me directly, I can give you some thoughts and suggestions on that.
Perfect. Another question is, what PPE is absolutely necessary for staff to be able to continue to do safe outreach? Gloves, face masks, and hand sanitizer in short supply for our program. We want to make sure we don't do any more harm than good by engaging in unsafe outreach efforts.
Yeah, so as best as I can tell from the materials that I examine and the people that I talk to, and I want to just provide another caveat again. I'm not providing health advice. I'm just relaying advice that I was provided, which is to say, if you're maintaining the physical distancing of 6 or more feet between people, you don't need masks. If you're not touching people's stuff, you don't need gloves. What you are going to need is hand sanitizer or access to soap and water in between encounters. So your outreach staff, if they're staying more than 6 feet away, don't need to be wearing PPE for every single encounter at this point in time. And I think if we kind of maintain that as the kind of key part of direct service, that it's going to be from a distance, then we're going to be okay. If we are in a community that has those things in short supply, then again, there will be limited situations where we apply that. So like, if you did have to touch someone's belongings, you want gloves. If there is going to be administration with overdose prevention or overdose response with naloxone, they definitely suggest using personal protective equipment in those situations. I mean, those are the sort of things that make sense, but routine outreach and engagement, maintaining 6 or more feet away from each other, not going to be necessary to have PPE as best as I can tell.
Okay. And for those folks on the line who, and I'm sure that's many of you who are looking for PPE, on the CNH3 website under resources, there's a tab on leadership and a few other things, including sourcing PPE. We found a couple of suppliers in Canada that could be able to ship to you. So feel free to check that out and access that for purchasing some PPE for yourselves. Lisa's asking how staffing will work for unsheltered people at the motels. Will staffing be provided for them, be left on their own? I think there's some good resources coming, if not they're already on the CNH3 website and other places for supervision and supporting people in motels. I'll let Iain jump in, but just I thought that it will depend a lot on who it is you're sheltering in hotels and what their specific needs are, but I'll let Iain jump in.
Yeah, so my general feeling on this is as follows. If it is predominantly or exclusively unsheltered persons who are making the move from being outside into the motel or hotel, then continuity of service with the outreach worker makes sense to me. In other words, these are the people that I knew when they were outside. Oh, guess what? They're in a motel. I still know them. I'm still going to serve them and support them. The bigger issue is in communities that are expanding motel or hotel options, kind of that surge shelter space approach, but they're not staffing it, and they're just assuming that outreach staff will now start doing outreach to motels and hotels. And I think that we need to take a strong stand against that and say, hey, look, it's not just unsheltered people that are in the motels or hotels. It's all homeless individuals, including a lot of people who were sheltered or people who have recently lost their housing. It doesn't make sense to be using a precious street outreach resource when we have so much education, screening, and service to do with other unsheltered people to take me away from those jobs to now staff the motel or hotel because you didn't think about the human resource needs when you opened it.
Mm-hmm. Okay, Linda's asking, any ideas for people being able to safely store prescription medication at encampments?
Well, safely stored encampments, I mean, like if situation was different and you actually had licensed clinicians and medical staff who could do managed medications, sometimes we've seen that within encampments. But other than that, I mean, the best thing that I think that we can be doing is maybe providing people access to the likes of a lockbox.
Mm-hmm. Yeah. Kelsey's asking, our shelter is only allowing people to leave for a couple of hours at a time and requiring folks to have pre-approval for all leaves. If you breach these terms, you're not allowed back in. This is creating more and more homelessness. Advocacy from our agency has not prevailed. What do you recommend?
I'd recommend trying to get the attention of a public health official who can speak about to why that's potentially problematic from a public health perspective at this time, as opposed to you trying to explain as a homeless service provider why that's problematic at this time.
Okay. We've got a question from Anlina. Apologies if I got your name wrong, but we work with in many small rural communities Most have never had a shelter, and many of the ones that do have closed them, so sheltered people are become unsheltered. Other than hotels, any suggestions for rural specific context for supporting unsheltered people?
Yeah, so I mean, at this time, talking to some rural friends of mine in a similar predicament who didn't have hotels or motels, they were able to find some houses for rent and kind of going a short-term leasing option on those. So I think that's a possible response. Then the other response that I've heard about but don't know a lot of details about was making a series of RVs available within the rural context at this time for unsheltered folks.
An anonymous question is asking, how do we help unsheltered homeless people who are very high risk to others who have criminal backgrounds? They're often rejected from shelters.
Yeah, so this will be one of those instances where shelter may not be an option. We're probably not going to fix that backwards thinking right now relative to criminal screening, and even when it might be relevant. I mean, you know, like there are some shelters that house families with children with single adults, and sex offenders or sexual predators wouldn't be a good fit for that environment. Those sorts of instances, I think, really lead us to the alternative models like hotels, motels, but if not, the other content we've talked about in this webinar in terms of staying engaged with unsheltered people and effectively doing symptom screening and access to resources and still trying to house people may be more helpful than trying to get people to move from unsheltered into shelter at this time and overcome all the barriers to shelter access.
Okay. And I think this will be about the last question, but Tori is asking, this week, when talking to street outreach workers, I could hear the weariness in their voices. They are seeing more people and there are less workers on the street. Any ideas on how to show support or appreciation for these workers? Some, if not all, are getting hazard pay.
Yeah, I think every community needs a bit of a pickup right now. Like, you know, morale is a difficult thing for all of us right now. And it's difficult for those people who are trying to make sense of service delivery within a confusing world at an unprecedented time in particular. If we thought that we saw the depths of despair before, we might have found a new gear in the depths of despair with everything that's going on with COVID-19. I think for those outreach staff, a bit of a structured conversation, I mean, a supportive conversation first. I mean, I forget stuff like that. But a supportive conversation first, but then, you know, sometimes that weirdness is driven by the fact that they're running their asses off, but they're not strategic about how they're doing it. So they're actually making themselves more tired and less effective by working longer hours, doing stuff that could have been managed, organized differently, and got different and more productive results within what regular hours were. So maybe it's a bit of a problem solving, like maybe there's a reduction. They might feel, for example, as an outreach team, I've certainly had these conversations in the last week, that they need to go 12, 16, 18 hours a day. They need to find every unsheltered person. They need to engage with every single one, toot sweet, ASAP, make sure they know the resources. And they're treating this like a sprint and not like a marathon. This is going to be with us for a period of time. We need our outreach staff to kind of go away from that initial gear of all in, both feet, super fast, turbo boost to, okay, maybe we need to go a little bit slower in order to last longer. And that's probably the sort of conversation that I would be having with the team that you described in the question.
All right, Iain. Well, I'm going to wrap it up there. I just want to thank you very much for the presentation and for answering all the questions. I think we got to most of them, if not all of them. I wanted to just say that we're going to be sharing the information. Iain's presentation will be emailed out to everybody that's participated in or registered for this webinar. We'll send his presentation along as well. For those of you who are looking for more information, we have as we mentioned in the chat, cnh3.ca/resources is where we're going to post all of this information and the documents that we get a hold of from Iain and others, and that's continuously updated. And just on behalf of the Canadian Alliance to End Homelessness and myself, I want to take a minute just to thank all of you for the work you're doing. It is difficult, it is thankless, it is very, very hard and challenging work at a very hard and challenging time. And just want to let you know that we want to thank you, and we're here for you. We will do what we need to do to support your work. So please feel free to reach out directly to us, and we will do what we can to help you. With that, stay safe, take care of yourselves, be well, and we will see you soon. Thank you, Iain.
Bye now.